So good afternoon, everyone. Thank you for joining our webinar this afternoon on the program Gift in Residence, promoting goodwill and countering intolerance between people living within collective and rent-based environments for older adults. Before we begin our proceedings, I would like to provide our land acknowledgement. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We seek a new relationship with Aboriginal peoples of this land, one that is based in honor and deep respect. Just some logistics for the session today. Just to remind everyone that everyone's microphones will be muted. We do encourage you, however, to make comments in the chat box and post any questions you may have for our speakers in the Q&A box, as you'll see on the bottom of your screen. There's both those boxes. And Benedict will be posting links and watching the comments and making responses to anything that's posted in the chat box to help us continue that dialogue today during our presentation. As I mentioned, we have our ASL interpreters with us. You can pin your ASL on your screen. You can manage your own screen settings based on the little box at the top right-hand corner. There's a little grid, and you can choose the settings or view that you would like to have on your screen. You can also move the line between the presentation and the speakers a little larger if you want to see the speakers on your screen bigger. We are recording today's session. It will be on our websites within the next couple of days after the webinar, along with the PowerPoint and a PDF, as well as any links that are shared during the session today. And finally, just a reminder, we do appreciate feedback. Just a quick pop-up will happen at the end of the session to provide some feedback. We do appreciate your responses. It takes, less than 5 minutes to click a few boxes to let us know how we did and any topics that you want to see in the future. Particularly this is an important topic around housing and how we can get along with it. When we're living together and in environments. If there's other things that come up about that communal living and better, informing people's respect and dignity and working in a safe environment, then that would be, appreciated. Just your feedback is so important. Just a reminder that this is a public forum, and we do appreciate your we want to respect your privacy and confidentiality. If you have a specific question or situation that you want to talk to us after, we've been more than happy to speak to you about that. You can email us or give us a call, and we'd be more than happy to help you. So if you can keep comments to more of a generalized questions as opposed to maybe personal circumstances, that we can further assist you in that way. For those who are just joining us maybe the first time for our webinars, we just will give you a little bit of background on our organizations. So Elder Abuse Prevention Ontario has been around for many, many years, over 20 years. And our vision really is to make sure seniors are safe and have a strong voice and are respected within Ontario. In 2003, we were given funding from the Ontario government to implement the Ontario strategy to combat elder abuse. And we are continually funded for that strategy now under the Ministry for Seniors and Accessibility. With that strategy, we work under three main pillars: public education and awareness, where we work on public education campaigns. We do a lot of education to older adult groups, and we do training for frontline staff. So those working in the sector, doing intervention or home support, and all sectors, we're providing further skills and knowledge how to recognize and respond to elder abuse. And lastly, coordination of services. We really work closely with our community partners at a local, provincial, and national level on how we can strengthen our response to elder abuse within our communities. I just want to say that we are hosting this webinar today in collaboration with the Canadian Network for the Prevention of Elder Abuse. And I'm going to ask my colleague Benedict to introduce herself as well as the network.
Hello, everyone. Good morning, good afternoon. I see and I recognize a lot of names in the attendee list, so that's very nice. Nice to see you all. For those who don't know me and don't know CNPA, we're the Canadian Network for the Prevention of Elder Abuse, and we are the only pan-Canadian network doing this work. So we're working to improve awareness, support, and capacity to develop a national coordinated approach to elder abuse and neglect prevention. And we promote the rights of older adults through knowledge mobilization, collaboration, policy reform, and education. You can find us online, of course, on social media at CNPA, as well as our website, which is the largest free library of elder abuse resource in Canada at www.cnpa.ca. Thank you.
Thank you, Benedict. Benedict and I collaborate on many of the webinars that you may see, because a lot of the work that we're trying to promote is on a national scope, including the project that we're talking about today. So when we do have these opportunities, we really take advantage of that collaborative approach so we can reach out to our agencies and service providers, as well as older adults across Canada, to provide further information and resources on work that's related to elder abuse prevention. It gives me great pleasure now to introduce our speakers today. We are joined by Roxanne Leboeuf, and she is the research agent as the research chair on mistreatment of older adults since 2012. She also has been a lecturer at the University of Sherbrooke since 2021. She's a doctoral student in gerontology and a proud recipient of a Canadian Graduate Scholarship awarded by the Social Sciences and Humanities Research Council of Canada. In 2017, she was appointed Commissioner of the Commission of Human Rights and Youth Rights by the National Assembly of Quebec. As a coordinator of the research chair and coordinator of various projects, she's collaborated on a number of working committees aiming at developing theoretical as well as practical knowledge relating to different aspects of aging, including countering mistreatment, bullying, promoting wellness, care, respect for the rights and freedoms of older adults. So welcome, Roxanne. And we are also privileged to have Marie Boulet, and she is an expert in the field, has been a colleague. I know of Marie for many years, so I'm so pleased she's able to be with us today. Marie is a fellow of the Royal Society of Canada, is an adjunct and retired professor at the University of Sherbrooke, and affiliated research at the Research Centre on Aging. She's a member of the National Seniors Council, and in 2022, the United Nations recognized her as one of the top 50 leaders of the decade of healthy aging, which is commendable. She has held a position of the research chair on mistreatment of older adults, financed by the government of Quebec. She's co-directed a World Health Organization collaborative center specialized on age-friendly communities and countering mistreatment. The focus of her 35-year career has been countering mistreatment of older adults. So I'm so pleased to have both of you today. Your expertise is going to bring such a wealth of information to our attendees today. So without further ado, I'm going to turn the presentation over to you and allow you to begin your presentation. So thank you.
Well, thank you very much, Rayanne, and thank you, Benedict. It's always a pleasure to have the possibility of discussing with colleagues from all around the country. And when I'm saying colleagues, it's people that are really concerned about countering mistreatment of older adults. So Roxanne is just placing our PowerPoint. Merci, Roxanne. We're online now. I'm very happy today because we're presenting you a program that is called Gift in Residence. So what is a gift in residence? Well, I'm keeping the suspense because Roxanne will explain in a few slides what we mean about that. But what we want to do is really talking about older persons living in collective and rent-based environments for older adults. If okay with you, for the rest of my presentation, I will say more congregate housing because it's easier to say. So this is a real partnership study. Actually, the program comes out from a research that was itself part of a larger program of research. We've been doing a series of different steps before developing the program. I had the partner in University of Quebec in Trois-Rivières, another one in University of Sherbrooke. There's been several research centers that were involved. Chartwell was also involved. I will talk a little bit more about it, but I just want to tell you that even if Chartwell has been pivotal to start this project, it's been always clear in our message with them that what we were developing was actually to be free for all congregate housing in Canada and maybe elsewhere. So the main funding in partnership was coming from the Social Sciences and Humanities Research Council, as well as from the Fondation Jasmin Roy and Sophie Dameret and the MeTax program in Canada. And the chair on mistreatment of older persons is financed by the Quebec government. So the plan today in the next 30 so minutes is to raise 4 points. First of all, I will explain the research process and give you some background in development of the program. Then the main results will be presented. And after that, we will discuss these results and we'll come back with a short conclusion and certainly keep time for a discussion with you because that's the most important. So here is about the process. Everything started well, 6 years ago, almost 7 years ago now, where Chartwell, which has a series of congregate housing buildings in the area of Sherbrooke, one of the director called the university and said, I'm very interested to be linked with researchers because I see a phenomena and I don't know how to react. And the phenomena was actually people talking badly to each other, people behaving badly towards each other. Actually, she didn't have the name exactly to really try to call it correctly. So, but we realized very rapidly that she was talking about bullying and also about mistreatment between residents, or what we can call also aggression between resident or resident-to-resident aggression. So we were put in a link, and I offered rapidly to Roxanne to be part of this project because Roxanne has been working in those types of congregate housing buildings. And also, she was just starting her PhD on the topic. So Roxanne has been there all during the process. So that's why I'm very pleased that she will be presenting the main part of this presentation today. So we got a first grant, a 1-year grant from SSHRC, and it was really a neat study. And we did some interviews in 3 of those buildings in the big Eastern Township region in Quebec. And we really wanted to have an ecological approach. So we've been talking with residents for sure, but also employees and general managers. And what we were looking at was mainly a discussion with people who did witness situation. And so we were not looking at that time for people who were victims of those situations or directly involved. And many examples came. And actually, what we found in that first needs study was that certain spaces may be more often the place where bullying will occur, such as the elevator, the dining room, or the rooms that are there for sports and leisure. So we decided to continue, and we got another partnership grant from SHIRC, which was a 3 years funding. So the project was really development and evaluation of a program. And the first phase was to continue the need study, but this time with people directly involved in the situations. So we've been working with 13 residents that were targeted, 6 employees, and also 6 interveners and managers of the residents. And then we developed a program, and this was a real collaborative approach. And we had different committees to develop the program, but one of the most important one was a committee with older person themselves being involved and helping us to develop and push forward different ideas. And in 2022, phase 3, well, we did the testing of our full program, which contains a lot of material that Roxane will be presenting. And this testing was really important to finalize the program. And since then, we've been doing some dissemination, both in French and in English, because it was important that we would be able to be in dialogue broader than the Quebec province or broader than the Francophone communities all around. So, Roxane.
All right. Do you hear me? All right. Okay. So thank you, Marie. Now that you has already explained the research project which take almost 6 years to do, I will present the main results from the need study and the results from the first phase of the second research, so which led to the development of program Gift in Residence. So during the interviews, we asked participants to give examples of intolerance. So what is intolerance to them, and what they have been a witness of it or the target of it. And Marie has already given few examples, but we will present some verbatim extract in order to clearly illustrate how intolerance can be experienced on a daily basis. So the first extract is from a man who, from a woman who says, "I saw a lady yesterday and she was crying. I asked her what is happening. Then the lady told me they no longer accept me in the room because they say I play cards badly." So here's the important thing to understand is that leisure context, as Marie said, is really conducive to situation of intolerance and more particularly to rejection, bullying. And we saw that in both of the researchers and in all residences with which we collaborated. The second extract, another lady says, "There's a lady who comes to eat. She likes the place where I'm sitting, and that is what she wants. She cannot wait for me to clear out to take the place. Even if I have not finished eating yet, when she arrives, she comes and stands next to me and says, 'Are you going to finish soon?' That's annoying. Then I eat at 11 o'clock and she arrives at 11:45 or 50 and she will stand there until I get up from the chair. Sometimes I have not got up from the chair and she's almost already sitting. So that annoys me." So as with the leisure context, examples of intolerance in the dining room were reported in both research studies and in all residences. So even if these residents, in these residents, there is no assigned or reserved seats during meals, people tend to be creature of habits. They like to sit in the same place. So it can be a source of tensions between residents. Considering the examples reported in the Gift and Residence program, intolerance between residents refers to all types of relationships that have a negative effect on each person. So this includes a variety of behaviors, conflicts, bullying, etc. And the extract that I presented also show that it is possible to see that intolerance can be psychological or physical, but some other examples were more about material or sexual situation. And Marie says it mostly occurs in public spaces, so dining rooms, leisure rooms, elevator, etc. And all residents can be target of intolerance. But during interviews, participants mentioned that being a new resident and therefore moving into a residence can be a moment where people experience intolerance. Several participants reported experiencing having difficulties to integrating with other residents. And they also mentioned that residents with mild cognitive impairment are also often involved in situations of intolerance, either as a target or as a person who commits acts of intolerance. But you have to keep in mind that in the partner residences with which we work with which we work in collaboration, there was residences for independent and semi-independent older adults. So no one had a severe neurocognitive impairment in our studies. As I said, the definition of intolerance states that it can have negative effects. So here man says, she makes me feel very uncomfortable. I do not leave my apartment anymore. I keep my door closed and I no longer want to know anything. Last year, I really like it here, but this year it is hell. So the effects of intolerance are really not trivial. They can be psychological and social, like we saw in this extract. So people were talking about social isolation, anxiety. Others talk about suicidal thoughts or having sleep problems. And the results also show that intolerance does not only affect the targeted residents, but it also affects witnesses, and sometimes it can be a more global dynamics that can take place throughout the residence. So now, what is goodwill? So in the interviews, participants clearly reported that even if they witnessed situation of intolerance, in general, they observe more goodwill situations among residents. So we had a wide variety of examples of goodwill behavior. So here you have a man who says that goodwill can be the act of volunteering within the residence. So he says, I think that one of the good things is how many residents get involved in all kinds of things. This must be also emphasized. There is the choir committee, a resident advisory committee. There's a group that take care of welcoming new residents. There's this lady with her group who take care of the pair program. And goodwill can also take form of sharing skills. So as this employee says, there's a gentleman who started giving some kinds of lectures. He is a former university professor, and for 5 weeks, he gave lectures on sexuality. He is a super intelligent man. It is rewarding for him. And here, the sharing skill can be from an educated person who shares their knowledge, but it can also be about smaller things like a pianist who give piano lesson. It can be very different from person to person. And for residents, goodwill is not only about big gesture, but it can also be about small everyday gestures. So here a lady says, well, people are in good mood. People are talking to each other. People are saying hello to each other. You know, when you are in the elevator, you don't know anyone. Well, they will say hello to you when you get off. So for participants, goodwill is very broad. In the Gift and Residence program, goodwill among residents refers to all relationships that positively affects individuals. So it can be mutual aid. I present you a very wide, many examples. And it also can have several positive effects. So in the previous extract, I talk about the sense of value that residents who perform act of goodwill can feel, but it can also help to consolidate the sense of belonging to the residents and to counteract isolations also. In order to determine the content of the program to be developed during our interviews, we documented the obstacles and drivers to intervention in a context of intolerance between residents. So Here a man says, when something happens, I say to myself, well, let's see what is happening there. Sometimes there are other people around, but then I say to myself, okay, should we leave that alone, or would it be better to tell someone about it? But who do we tell? I don't know. So what emerged through this is, as I said earlier, intolerance does not only affect people who are directly involved, but it also affects several people, witnesses, and larger in the residence. So it's really important to also equip witnesses, but more broadly organizations, so intolerance can be addressed in a collective and organizational manner. Among obstacles to intervention identified in the extract, we saw that we see that the participants speak about the lack of knowledge about resources, but others talk about fearing reprisal from the intolerant person, or talk about being unsure whether the behaviors were intolerance or not, or whether an action should be taken or not. But we also learn more about several drivers. So some said they acted because they had a good relationship of trust with an employee or a manager, so they felt safe to talk about the situation they witnessed or they encountered. Others said, I wanted to act because I don't want this to happen again to other people, or I decided to act because I have reached my limits and I want things to stop. So among the needs about what the program should contain, many participants mentioned the need to be informed about intolerance, its effect, its cause, the need to develop a process to manage situation of intolerance, the need to clarify the role of everyone, employees, but also the residence committee, the need for everyone to be trained, the need to know about the resources in the residence, but in the community, the need to improve the positive communication, the need to enhance the integration of and adaptation of new residents. So I will stop there, but you can see that participants had a lot to propose to develop the content of the program. And you will see in the next slide that it is a very complete program which contains many, many, many elements. And with all that in mind, what is the program Gift and Residence? So like Marie said, the word gift in the name, in the title, stands for Goodwill Against Intolerance for Togetherness. And togetherness represents the idea of promoting and spreading a culture of goodwill inside the all residents. And to whom the program is addressed, obviously older adults in the residence, because ultimately the program aims to improve their well-being. But the program is also addressed to the residence committee because of the role it can play in receiving testimonies and promoting goodwill. And of course, the program is also addressed to employees and residence managers, since they each have specific roles to play in implementing this program. The goal of the program Gift in Resident is double. First, it aims to provide tools and activities to promote goodwill in the resident and to develop a culture of goodwill and to facilitate the adaptation and integration of new residents. But secondly, the program aimed to counter intolerance and more specifically to propose intervention tools and to clarify the management and follow-up process. And to do so, more than 30 activities and tools were developed. And the program also presents many other activities and tools already offered by other organizations. Because what you need to know is that in Quebec, we have a governmental action plan to counter mistreatment of older adults since 2010, and a governmental action plan to counter bullying since 2015. So both have measures targeting people living in residences, and therefore there are already several activities and tools that have been developed over the years. But most of these tools aims to improve awareness, prevention, and detection. So we did not want to produce a program with things that already existed. We wanted to develop a program, new activities, new tools that in a way that will complement what is already offered in the community. So the program is intended to work in synergy with what is already existed. The program Gift in Residence is divided into 4 documents. The first is the presentation of the program, aiming to optimize its implementation. So in this document, residences are invited to diagnose their needs. By answering a few questions, they will be able to establish their priorities for action, and then they will be guided to the corresponding module and to which person needs to be involved to implement it. Then, since it's not a single tool, but we can say it's a toolkit, the program contains several elements. So it is intended to enhance the many organizational changes. So the program aims to be integrated in the way of doing in the organization and to improve it. So to achieve this, the first document proposed various evaluation and sustainability mechanisms to be implemented so that the program can continue to live over time. Some of the advantage of the program is it can be used in whole or in part, depending on the needs of the residents. But for more optimal achievement of objective of promoting goodwill and countering intolerance, we recommend that all modules must be implemented. So once the first document is consulted, residences are guided towards the implementation of one of the 3 modules. The first one aims to propose a mechanism to improve the adaptation and the integration of new residents. The first mechanism proposed is a process of pairing a new resident with a welcoming resident. And this element was developed because during interviews, participants indicate that things being done in their residence to welcome new residents were generally done by managers. And they noted that this is not enough to create a sense of belonging, neither to help people create connection with with other residents. So they said it would be more effective if part of the welcoming process was done by other residents. So Module 1 provides a step-by-step how to set up a pairing process. And we give many tools to like information forms about new residents and welcoming residents to reinforce that process. Secondly, Module 1 offers some activities to facilitate the integration and the creation of relation between residents. So here you have the example of the game Tell Us About You. So it's a group activity which can be used during monthly activities aimed at welcoming and celebrating the arrival of new residents. So the game can be projected on the wall. Participants have sticky notes, and when they roll the dice, they got into a box, they have to answer the question. So it's a great way to make people talk about simple question, and they get to know each other better. So they can create new relations. In the program, each activity is accompanied with a 1-page summary descriptive sheet, which will briefly describe the activity, the necessary material, as well as the access of the documents. So in the module, you can click on the link and you can download this game, for example. You also have the procedure of the activities and sometimes alternative ways of leading the activities from time to time. Activities are also accompanied by evaluation form to be completed by facilitators and residents. So the objective is to ensure a better sustainability over time. So after each activity, the facilitator and the residents complete the form, and they note what they like or not. Is this an activity to do again? And if so, what should be done differently? How can it be improved? So this allows the facilitator to make each activity its own, so it meets the need of the residents. Module 2 aim to improve the process of managing situation of intolerance. So as I mentioned in the needs section, there was a great importance according to in training employees and managers. So which since access to training is not always easy, in the program we have developed 5 short training videos lasting 5 to 10 minutes. And all videos are free and are included directly in module 2 via clickable links. So you have the 5 short video here. And in addition to this training video, we have created list of training already offered by other organizations. We have a provincial list, but we have also 2 specialized lists for the region in which the partner residences were. Sorry. And the residents are ready, have already all they have in hand to create an annual training calendar. So according to the needs and interest of employees. So the program gift in residence is intended to be a turnkey tool. Still in module 2, several tools are proposed to clarify the process of managing and monitoring situation of intolerance. So what you see on the right is the decisional diagram for the management and follow-up situation. It is accompanied by a documentation form of situation and a checklist before concluding an intervention and a follow-up. So these tools aims to ensure that situation as well as intervention are properly documented. And although the majority of situation can be managed by the residents itself, there are several resources that can help depending on the situation. So in order to facilitate knowledge and use of the resources in the community, we have created lists which present accessible resources. So again, there is a provincial list, but 2 regional lists as well. And the last module is about, concerns the promotion of goodwill. Sorry. So this module aims to propose to support the development first. Sorry, I will restart my phrase. The first mechanism presented is how to support the development of entities by and for residences. As I mentioned, in the needs section, there was a great importance according to clarify the role of the residence committee. But during interviews, during the project, we realized that not all residences had residence committee. So Module 3 provides a detailed process to support the creation of a residence committee or a goodwill committee. And still in Module 3, in order to promote goodwill and raise awareness of intolerance, we developed a poster campaign. So on the left, what you see is one of the 6 posters on goodwill. In the center, you have one of the 6 posters on intolerance. And in that one, we show example of intolerance. And even though we say in the program that it's important to talk about the situation to an employee and managers, we also wanted to expose some resources outside of the residences. So in the poster campaign, we talk about the mistreatment helpline. So this is a free provincial telephone line accessible all year long, all day long, between 8 a.m. and 8 p.m. So people can talk and have can talk about their situation, can get information, etc. And the last one on the right is one of the 2 posters which propose action to witnesses of intolerance. So what can we do when we witness a situation of intolerance? So you can diffuse by using humor, you can divert the attention on one of the 2 persons involved, or if you are not well to do so, you can also talk about it to talk about the situation to a trustworthy person in the residence, so someone else can intervene in the situation. still in module 3, I told you there was a lot of things in our program. So still in module 3, several activities aimed at promoting goodwill and countering intolerance are proposed. So as you can see from the brief list on the screen, the objective is to reach as many people as possible, regardless of their interests and personality. So there's some individuals activity, there's also group activities. So you have the classic bingo on, but specifically about Goodwill. You have collective word of poetry, but we also propose some collective activities. So what you see on the right is one of the 4 posters entitled Acts of Goodwill. So during an Act of Goodwill Day, all residents are invited to take up the challenge of doing several actions proposed throughout the day. So you have 6 examples. So it's a variety of activity that allows the residents to keep the promotion of goodwill and the countering of intolerance active throughout the year. So this module aims to support and reinforce the other actions and tools implemented with the module 1 and module 2, sorry. In addition to all the activities developed, we also have made lists of others activities and conferences offered by other organizations. And the last thing proposed in this module is the co-creation of a Goodwill Charter. So this is an activity by and for residents, which means that residents must be actively involved in developing the content of the charter, and the charter after that must be signed by all residents, employees, and managers, and can be displayed for everyone to see in the residences. So once again, the program is intended to be a turnkey tool to allowing residents to create an annual calendar of activities according to the needs and interests of residents. And on the right, you see the example of an annual activity calendar proposed in Module 3, so which can obviously be adapted. So for each month, we target a special day. And on the right column, you see one of the activity proposed. So you can see that the program aims to be as complete as possible, which offer a wide variety of tools and activity that really help to promote goodwill and to counter intolerance. So I will now give the floor back to Marie so she can talk about the evaluation and the pilot testing.
So yes, let's go into the evaluation of the pilot project. Like I said earlier, it was a large team. So this part was under the postdoctoral of Marie-Chantal Falardeau. And with her, we actually wrote a systematic review of intervention that have been validated in the field. This paper is accepted by the Journal of Elder Abuse and Neglect, should be out anytime now. And we also wrote another paper on the evaluation per se of our project. This one is under evaluation by a journal. So first of all, looking at promoting goodwill, well, actually that part of the program was very well achieved. Let's give you an example by this quote by a resident saying, "It's a village here. I edited and published books in the residence during the pandemic so that people would be less bored. I thought people have a lot of time on their hands in their apartment. They have time to reflect on their life. So I invited people to tell me their story. Approximately 13% responded, and I had a lot of support from the management to produce the book. We sold 110 books in 2 days." So we see here that there's some benefits to the program Grift in Resident by, first of all, promoting a culture of goodwill within the residents, but also, in this quote was actually showing it, promoting new ideas to be developed according to the objective of the program. And this time the idea was coming from a resident. So it's not only a manager thing. Actually, there's a lot of room for bottom-up activities. What has been identified as facilitators are first of all, our approach of combining two forces that can be seen far away from each other. So promoting goodwill and also countering intolerance. So not only talking about something negative, but also pushing further something positive. It is also the adaptability of the program in the resident context, because as Roxanne said, there is a plethora of activities, but they can choose. It's not a rigid program. It's something that residents can applicate the way they really want it. Certainly, it was helpful to have leaders and the residents supporting the objectives of the program, and mainly the collaboration also of managers and staff members, and certainly also the support of the research team, like especially Roxanne and Marie Chantal have been going around many times in the residence to be certain that everything was coming. The second objective of countering intolerance was partly achieved, and I'll explain why. First of all, there was some challenges, in integrating tools into the situation of the management process, and also some challenges to systematically document situation of intolerance. What were the identified obstacle was labor shortage and high staff and residents turnover, and that's really major. And on this point, I want to stress that one of the things that came out from the evaluation is that you need to put back all these activities all year long, because you have different staff and also different residents. A work overload, the fact that it was voluntary for the seniors to participate in the activities, and some residents actually didn't want to come. And a lot of time, these are the ones that maybe can be more seen as being intolerant. And all of that, I didn't say it, but you saw the dates of our project. We were during the pandemic. It was very difficult to implement and keep contact, and things that we were supposed to do in person were done by phone, were done outside. So it's been really demanding. So, but the evaluation helped us to improve the visual and the content. We also added different means to ensure its sustainability. And also we developed a training program to support the implementation. And for that, we did a partnership with a federation that is present all around Quebec to look at leisures and congregate housing for seniors. So in conclusion, well, as you see, we're really promoting goodwill and countering intolerance in this program. It's done to actually, our aim is to have lasting organizational changes. We, like Roxanne said, we have some original tools and activities that we developed, but also we didn't want to pretend that we were the first one to work on that, because there was a lot of good material that we integrated with the permission of the people who did it. It's the turnkey program that can be adapted to the needs of each residence. And we're very happy to have we did have the time to develop and test in close collaboration with residents, staff members, and managers. So we're certain that it's fitting for everyone. And you have here a code that you can actually scan with your phone. So this is new ways of doing things. And I must say this was the idea of Roxanne, because I'm not used to work with that. So thank you very much for being with us. And I think we still have like 10, 11 minutes for discussion. And it's important for us to hear your comments and also answer your questions. Thank you.
Thank you, Marie and Roxanne. So yes, you're right. We have 10 minutes for questions. We're going to give people just a moment to digest and type up their questions in the box. I'll get us started. I had a question because that kind of stuck with me even last week when you did this presentation in French as well. The importance of adapting the words that you chose between, bullying and intolerance and goodwill versus, well treatment is not really a good word for English, but there's an equivalent in French. Can you get into that a little bit more? What was the feedback? What doesn't work with some of these words, or what's the effect or unintended effects maybe?
Yes, maybe I could start. Like, we're a research chair on mistreatment of older persons, so we would have used mistreatment but people didn't like that term at all. So that was clear. Neither abuse, neither bullying. Even bullying was too strong. So what they were trying, because we wanted the program to reflect something that they could talk day to day. So we had a group and we did a consensus meeting that Roxanne facilitated. And what came out, it was seniors, but also we had practitioners and we have different person around the table. And intolerance was the word that actually seemed the most appropriate to go push forward things. Same thing regarding the term for the positive side. Goodwill it was the one that was the most consensus. In French, like you said, Benedict, we have bientraitance, which is very difficult to translate in English. And that term was rejected because in the word traitance, people were seeing kind of a medical component that they didn't want. So goodwill is something that is very positive and they liked it. Roxanne, do you want to add something?
Yeah, maybe the fact that some people didn't want to use the word mistreatment because and preferred to use the word intolerance because to them it was more easy, if I may say, that I can be intolerant from time to time, but being mistreated, a person who mistreat others, it's a bigger word. It was maybe too big of a burden to have to use that kind of word. So I think people related more about intolerance in that way because, yeah, I can be intolerant today about this person for some reason, but I'm not always intolerant. So it was seeing that it's something you can easily work on it. You can easily improve yourself to be more tolerant. So some people say that during our focus group.
Some kind of positive reinforcement.
Yeah.
Okay, I see. It was actually, I think, Marie, you've said that before without belittling or infantilizing people, but it's very reminiscent of the kinds of behaviors you see and you experience very often when you're younger too. Some of the examples that were given, I remember thinking, I guess we never learn. But so, and you mentioned another question I had for you. I'm just monitoring the chat. There we go. We have a few questions. So maybe I'll let people ask theirs first. George wants to know, how do you determine what is prejudice? That's a tough one. That's a broad question.
Well, there's a literature on that, but how we did in our research, actually, it was from the interviews. People, when we did the interviews, were talking about what they saw or what they felt, because sometimes, like we said, they were the target or they were the practitioners that were involved. And then they were talking about consequences and prejudice, but on their own way, and sometimes was short term and long term. So we really documented it from the point of view of the participants. Certainly, we did some comparison with the literature, but the project itself was very rich about consequences and prejudice.
Thank you. We have a question from Wine asking, are there differences in the manifestation of intolerance between the French speaking community and the English speaking community? Did you witness any differences in either behaviors or reasons, motivations?
Roxanne, you have something
Maybe I can. In the first research, we tried to reach French and English community. We have a residence where there are both, but we didn't see a big difference between French and English community. And I have the hypothesis that maybe there is something between French and English people in the same residence, but there was not. So no, we didn't see a difference between French and English population, but I have to say that most of our participants were French. We only have a few participants who were English, so we don't have a lot of data to support that.
And was language ever a reason or a motivator for tense relationships between residents, or was this not something that presented itself?
No, it's no one talk about. We asked managers of that residence if this was something they witnessed. Even we also asked employees if there was something they witnessed, and they had no example to tell.
Okay. We have a question from Jane asking, would this program help a building where many seniors are lonely and do not come out to do activities?
Well, certainly, like I said, we work with Chartwell because they called us, but we really are clear about the fact that this program can help in any type of congregate housing for seniors. And actually, I think that maybe it could be larger than that because somebody already asked if it would be we could actually adapt it to long-term care institution, and I think that certain activities could fit. The problem would be more the cognitive component in those housing facilities or care facilities. So certainly this program can help in a lot of situations. But one of the challenges, and I said it, was to have certain person to participate in the activities because it's not mandatory to participate in the activities in those places and perchance. So people go if they feel that they want to go or something like that. But what we saw, and we have a couple of examples, Roxanne and I, that we really smiled when we saw a few things. Like in one residence, there was a man that it was known to be quite intolerant towards other, but there was another man that was really involved with us. So when we came to do the last presentation of the program, he banged on all the doors and he assured that this man would come with him. And he said, "Oh, you're going to have fun. It's going to be interesting." And actually, he told us after, I was really hoping he would be listening because I thought he could learn from that. So when you have positive partnership with residents that are positive models and they help, that was really facilitating. But that's always an issue. How do we connect with the ones that don't go out?
And so I think you kind of touched on the following question that I was going to ask you, which someone is inquiring whether this is something that is only for independent and assisted living or whether that is also for long-term care.
It was developed for independent living, but I think it could easily be adapted, at least in part.
Roxanne, let me know if you want to add anything. No, you good? Okay. We have a question from Dia saying, I'm curious about your success in having seniors and management see certain behaviors as mistreatment. For example, in my industry struggles with the inclusion of seniors with light memory loss by seniors with no cognitive issues. You discussed using the terms intolerance or mistreatment. Was memory loss an area that came up, and how was it managed in the study?
Yes, it was something that came up. Like I said, some residences who had light in cognitive impairments were sometimes the target, or sometimes they were the one who they were intolerant. And during the evaluation part, many people talk about the need to be more informed, trained about how to react, to act with these people. So that's why we added a fifth training video specifically about how to intervene with a person who have some cognitive impairment. So yeah, it was something that came up in the research, and we addressed it.
And will that fifth portion be part of the material sets that will be available in English shortly?
Yeah, the video is already, actually the video is already ready. It's already accessible, but it will be with a link on in the module 2. So when the module 2 will be ready, people can download the document and just click on the link and have access to it. So yeah, in the next few days, everything will be accessible.
Okay, and I will repost the link to your website as well for people in the chat box so they know where to go. We have a question that is not super clear, but I think it's touching on situations where between a resident and a caregiver or a person that's there to assist in their living establishment. What if the issue is between these two people instead of being between two older residents? Is this something that you have looked at, or that are there resources about that?
The research here was really on resident to resident. However, examples came out in the interviews. And as researchers, we really choose not to stop when somebody is talking about a situation. We're not saying, no, we don't want to hear about it. But actually, it's not something that we work to develop. But the actual chairholder, which is Mélanie Couture, has a research project on management issues with residents. And so she's looking at other sides of what we could call poor dynamics in those types of housing facilities.
Great. Thank you so much. And with this, that takes us to the hour. So we're going to end here on time for once. Thank you very much for your time today, Roxane and Marie. Rayanne, if you are around and you want to say the last few words, please do. And thank you everyone for coming today.
Yes, thank you everyone. We will share our PowerPoint deck. Just as a reminder, we are working on developing, or we are hosting a conference, I should say, next week on the 29th on gender-based violence in collaboration with the Canadian Network for the Prevention of Elder Abuse, as well as Women Act. So you can check that out on our websites as well. And we are also hosting, Elder Abuse Prevention Ontario is hosting a risk assessment training as well in December. So if you're interested, you can sign up for that as well. So thank you all. Thank you, Marie and Roxane, for your presentation, and our interpreters today for your support. Thank you for your questions and your attendance, and we will get this posted as soon as possible. So thank you, everybody.
Merci.